Going to St. George's was a great decision for me.
I believe that SGU has really helped propel me towards my lifelong dream of becoming a doctor.
I'm very confident that I wouldn't be where I am today. I wouldn't have gotten residency at Mayo Clinic if I had gone to any school other than St. George's. SGU was the best investment I've made in my entire life, absolutely.
SGU has graduated now over 18,000 graduates from our School of Medicine. These graduates have practiced in all 50 U.S. states, as well as more than 50 countries around the world.
We've been in existence for over 40 years, so we've trained a whole lot of doctors. And probably one of the most unique advantages of coming to St. George's is the amount of support that we give to our students. We attempt to make every student that we accept to the med school be successful, and we can offer a wide variety of educational pathways leading to the MD degree, which means the vast majority of students that want to be physicians are going to become physicians.
Drive to become a medical doctor will come from within yourself, but it's nice to know that you're coming from an environment that breeds really successful physicians. On campus, an SGU lifestyle, I think, is similar to a school in the States, except you have this beautiful environment where you're really focused on becoming a doctor.
This is a comprehensive campus. We have 65 buildings. We actually run our own bus service. We have our new exercise facility, restaurants, and our brand new dorm is spectacular. We really cater to the unique needs of all of our students and create an incredibly safe and supportive environment.
I felt that SGU really wants you to be a family amongst your peers.
The key to medical education is the learning group size, because that's the environment where you're learning medicine. And most of our curriculum is taught in small groups of 8.
One of the things we do here is we've set up DES, the Department of Educational Services, where our students learn how to learn.
We really focus on the individual. It's really student-centered education.
We work with students in workshops, we work with students in small groups.
They provide practice tests, educational material, all of that. And so when I took step 1, for me, it felt like taking another St. George's test.
We're often judged by the success of our students in USMLE exams, and in fact, we are virtually identical to a US medical school in our success rate. But in addition to standardized tests, I think we are particularly good at preparing students to be lifelong learners long into their careers.
The first 2 years in Grenada really prepared me well to succeed here in clinical rotations.
And I do believe that these clinical rotations are probably the most important aspect in trying to narrow down what you want to do for residency.
St. George's allowed me to do multiple rotations, to repeat rotations that I was interested in, and were incredibly encouraging.
We have relationships with over 70 hospitals. So it's really an opportunity for our students to think about, where do I want to train to get the residency that you're looking for?
I'm a second-year resident, and I know this is a privilege. It's a path that not everyone gets to walk, and SGU is really the stepping stone that enabled me to be here.
If you look at the average residency placement, all those numbers are on par, if not better, than the US averages, and that's a testament to St. George's.
I'm a big believer in diversity, and all one needs to do is come on the campuses and walk, and you look around you and you see diversity.
You've got students from, multiple different countries. You learn about their backgrounds, their customs, their cultures, and having that exposure is crucial, in terms of being able to take care of people down the road.
Our students have the opportunity to train all over the world. We have actually been working in partnership with Northumbria University in Newcastle, England, and one of the things that we can now offer to students is to spend the first year of your medical curriculum in Newcastle.
It gives you a perfect combination of doing 1 year of school in England and 1 year of school in Grenada, and then your clinical rotations in North America, or to come back to the UK.
That type of international medical education is not only extremely valuable, but is quite unique.
Being a doctor in the 21st century, I think not only means being able to take care of patients, but also making sure that you continue to better yourself as a doctor. That's a really key point here, is that St. George's does a phenomenal job at getting you ready for your career.
I don't think that I would have been able to get the experience that I've gotten here at SGU anywhere else.
As soon as they drape the white coat over you, you kind of have that sense that this is the beginning of the journey.
You have to believe in yourself, believe in the effort that you have put in.
If you put in the work, I mean, doors will fly open for you. And I'm just very, very fortunate and thankful for that opportunity.